as I said, we use low dose dexamethasone. Keep in mind, low dose dexamethasone we use. We don't use tocilizumab routinely unless it's multidisciplinary approach approval. But you can use tocilizumab if there is a severe disease with approval of multidisciplinary team, because so you have to do, you have to take certain precaution before you use tocilizumab. You have to exclude liver disease, organ dysfunctions, and bacterial sepsis, and you have to show that is purely due to the deterioration due to hypoxia or with pneumonitis. So you can use add tocilizumab, and you can increase the dose of steroid. Mind you, before you increase, you have to exclude bacterial sepsis and other causes. As I mentioned, the list of investigations. So you must do the investigations and prove it and increase the steroid. Otherwise, you can go for pulse therapy, steroid pulse therapy, methylprednisolone pulse therapy. That is 1 gram BD for 3 days. For 3 days and then continue 1 to 0.5 to 1 gram methylprednisolone for 3 days. You can continue, and that all we have at the right now. But remdesivir, antiviral, and all those you can't give because it's late onset of late in the disease. You can't, it will not work. So if you want to give remdesivir, you have to give in the viral sepsis period. But otherwise, it's you are not very useful, and you exclude other causes, as I said, pulmonary embolism, cardiac causes, and all those things. So if hypoxia is with pneumonia, you can increase the steroid or add tocilizumab.
Okay.
I hope I will.
Okay, thank you very much for the clarification. And the other question is epilepsy a contraindication for Covishield vaccine? Is epilepsy a contraindication for Covishield vaccine?
Epilepsy is not a contraindicated for vaccines.
Okay, so thank you very much. The other question is, does full blood count help to identify any progress or severity of the illness? I think Dr. Ramesh can answer this question.
Yes, this full blood count actually it will show the lymphopenia in the early viral phase, and WBC may be normal or low side, and the thrombocytopenia, you may experience mild thrombocytopenia. The problem is severity of illness. You can't actually say with this full blood count, but you can say if the neutrophils count is percentage and neutrophil count is higher, total WBC is higher, you can say this patient may be with the clinical correlation, maybe some secondary bacterial infection you can suspect. And also with the thrombocytopenia, if it's a worsen, it can be a marker of the severity, but not much you can take it from that.
Okay, the other question is, what are the indications for ivermectin?
Currently, as I said, currently indication only if you are living in a strongyloidosis endemic area, you can give. That is also second week of the illness to prevent strongyloidosis sepsis. So disseminated strongyloidosis, you don't call it sepsis, disseminated strongyloidosis. But currently there are a lot of trials going on for ivermectin. Some trials showed some promising evidence, but still not in the guideline.
Okay, thank you, sir, for the answers. And one more question we can underline. What is the analgesic can get after vaccination who is allergic to paracetamol? What is the alternative analgesic after vaccination?
If allergic patient to paracetamol, you can get even a small dose of NSAIDs. It is not much harmful, but you can get some tramadol, non-opioid like analgesic you can get.
Okay, thank you very much. And it's come, so it's the end of this webinar, and I would like to call Dr. Sundaresan, who is the president of the Particular Medical Association, to give a vote of thanks.
Thank you very much for all the three speakers. And I think we will continue. This is the third or fourth series of lectures. And so next week, probably with this COVID series, there's another expert who has treated nearly 6,000 patients, and he has only 14 deaths. So that means 0.2 death rates. That expert, probably we should be able to get him. He's from India, and we will inform you all. So tune in with us. Again, thank you all for three speakers. And if the audience here, if you can tell what you all want in the future, we are ready to share. We can give some more Zoom lectures. So with that, thank you very much for Dr. Vishnu as well as all three speakers. Thanks.
Thank you.